let's talk about the chest wall and the diaphragm. I'll go ahead and draw in the rib cage here so that we can go ahead and discuss the specific features. It should be noted that the ribs are broken down into true ribs, false ribs, and floating ribs. Ribs 1 to 7 are the true ribs, ribs 8 to 10 are the false ribs, and ribs 11 and 12 are floating ribs. These are true ribs because they attach to the manubrium and the sternum, and the false ribs all coalesce together with the costal cartilage in order to still attach. And then 11 and 12, like the name implies, are floating ribs, so they're not really drawn here. And then going on, the thoracic inlet is the uppermost opening of the thorax, and the thoracic outlet is the lowermost opening. It should be noted that thoracic outlet syndrome is more of a medical term, and that actually occurs up here between the anterior and middle scalenes. But for in an anatomical discussion, the thoracic inlet and outlet are labeled as such. Now discussing a couple of landmarks, the jugular notch is actually right where this arrow is pointing. The angle of Louis is at T4. That's an important landmark for many anatomical structures that occur there, including the pulmonary trunk that bifurcates there. The xiphosternal notch, located at T7 over here, is an important landmark for many procedures, including paracentesis. The costal margin is just this lower portion of the costal cartilage. The 12th rib, like I said, it's not pictured here, but it does end up being an important landmark for where the kidneys are approximately located. The transpyloric plane, which is located at L1, way down here. There are a couple of structures that occur there. T10 is the umbilicus. The mid-axillary is, axillary refers to the armpit, so the axilla. So that's more over on this side. I can't draw it super well. Mid-clavicular, though, that is a good landmark, and you can think about where the clavicle would be and then just down from there. These are good areas and descriptions that we can use to localize specific anatomical structures or medical occurrences at that place. It should also be discussed when talking about ribs that there are two different types of movement within the chest wall. There's both pump handle and bucket handle. So that sternum has more of a pump handle. You can kind of see in this crude drawing, it acts sort of like a pump handle. It'll move anterior and posterior. The ribs will move more of a bucket handle motion, and there is some variance within the ribs, but generally they're going to move like that bucket handle up and down laterally. Let's go ahead and talk about rib organization. So this is external and this is most internal within the thoracic wall. You could just think of this like a cross section, and each of these are ribs. So the external intercostals, the internal intercostals, and then innermost intercostals, and sandwiched in between those internal intercostals and innermost intercostals are the vein, artery, and nerve. That is the intercostal artery, intercostal vein, and intercostal nerve. And that is important because when we are going to do any sort of puncture in the thorax to relieve a pneumothorax or a hemothorax or any other sort of abnormality, we want to come from the most superior aspect, because if we go from the inferior aspect, we would be very liable to damage any of those structures, especially the nerve. Now, when we're discussing the diaphragm, T8, T10, and T12 are important because, again, this is looking at this from an inferior perspective, sort of like an MRI or a CT. We can see that T8 is the IVC, T10 is the esophagus, and T12 is the aorta, with the right cruise wrapping around the esophagus. And just to also know, the ligamentum trites also attaches to the right cruise. I think that does it.